Hi there, this is just a short video recording my last day of school before exams. I really should be revising now, but decided to procrastinate a bit. As usual, I wake up around 10, and since school is in the afternoon, my friends and I will be having lunch before school. And yes, here are some cute videos of my puppy saying good morning to me. Quick change and we are ready to go. So we have decided to eat around Central, which I haven't been here for quite a long time. We're having some Taiwanese cuisine today. This is my scallion oil strata chicken mixed noodles, directly translated from Chinese. And my lychee green tea with IU jelly. Sorry to all the boba fans out there. And of course, I have my friends with me. Naughty. After lunch, we took the minibus to the medical campus. Just wanted to supplement that we haven't been back to school since February due to the 5th wave lockdown. We have had Zoom classes for 3 months, but as the lockdown measures are relaxed a bit right now, our practicals resumed and all packed within these 3 weeks. Prior to this, we had lots of dissections like 3 times a week, but we'll be having clinical skills today. We learn about physical examination skills in these sections, and it is more practical in a way that it prepares us better for the clinical years because this is how we actually examine patients. Today's section is on blood taking, which I would say is the best clinical skills lesson you will get within the 2 years. We had to watch some videos beforehand and watch a demonstration before we could actually do it on human beings. Oh, and of course, we have to practice on mannequins before as well. I'll just briefly describe what I'll be doing on the mannequin, but this might not be as accurate, so forgive me for that.
So first, I do hand hygiene wearing gloves. Then I make sure all the equipments are around me, like tourniquet, blood-taking needles, lab specimen bottles, blood transfer devices, etc. Then I try to identify a prominent vein and apply tourniquet to the patient, remembering to disinfect the skin with alcohol wipe. Then I insert a needle at a 30-degree angle until I see blood entering the catheter, which means I've just poked a vein. Ouch. After that, I inserted a bottle at the other end to collect blood. After collecting bottles of blood, I remove the tourniquet before the needle and place a cotton wool to stop bleeding on the patient.
As easy as it seems on mannequins, I can say that it's completely different to do it on an actual person. That I failed many times. Here's just a video of me trying to take blood from my poor friend Christy.
She's Odell's professional cameraman and the crewmates. Hi, crewmates.
She placed a lot of trust in me, but I ended up failing not once, but like thrice. And oh no, she is in pain. Looking back at this video, I just felt really bad and guilty for what I have done. So if you're watching this video, Christy, I'm so sorry for having you to go through all the pain. I ended up getting blood from my other friend because his veins are more prominent, which means I have a higher chance of succeeding. But I failed the first time. I know what you might be thinking right now, that you would not like to be my patient in the future. But I believe that med school is like this, like we try, we fail, we reattempt until we succeed. Next, it's my turn to suffer. Just kidding, because I trust Isabella a lot.
Oh, yay, okay了。Hey, fucker. Hey, why is it going like this again?
Because slightly adjusted.
Oh. Oh, sorry.
And she did it.
Very trustworthy doctor.
The blood we collected will be sent to the lab for analyzing, and a report will be issued back to us to see if we have any hematological abnormalities. Back to reality. Exams are coming in less than a month's time, and we have so much to revise because it basically covers everything we learned throughout the preclinical years. Like, I know that it's impossible to learn and memorize every detail, but I felt like there are a lot of stuff that I still don't know or cannot seem to retrieve it from the back of my mind, which I sometimes blame myself for. This makes it really stressful, but I guess I just have to admit that we'll never be 100% ready for exams, that we are not perfect human beings. So if you guys remember from the last video that I was making notes for my drugs, and I emphasized how hard it is to revise for drugs, and I struggled, I ended up trying this new method of remembering drugs. This is actually quite similar to the concept of people using ENG deck for revising, only that this is an actual deck of cards. This is a rather new way of me trying to revise, and I'm not sure if this is very useful yet. But again, med school is all about trying, changing until you found a way that suits yourself. Even until now, I think that there are still many ways that I could have revised. So same as the nature of medicine, it's all about lifelong learning. I might end my video here because I have nothing more to share besides from revising. Good luck to everyone having exams soon. And thank you for watching till here, where I pour my heart out to you guys. I shall see you after my exams. Hopefully that I passed everything and I could enjoy summer. Bye!
我啱啱出嚟咗。啱㗎。嗰個人死咗啦。睇你點做先？好。哇！點死咗？